I think right now, in today's current environment, the number one priority is access to care and access to therapies in a time frame that actually matters to those families.
Hi, I'm Jeff Schaffnit, and I'm here today with Phil Gattone from the National Bleeding Disorders Foundation. Phil, I'd like to ask you a couple questions. What do you want people to know about your mission?
It's great to be with you, Jeff. And I want people to know that we have a three-part mission at the National Bleeding Disorders Foundation. The first part is we're all about finding cures and making those cures accessible to people. That's number one. Number two, it's really helping to alleviate the side effects and the consequences of bleeding disorders. That's a big part of our community's need right now. And third, it's really to help people thrive and families thrive, because anytime we can get a family to get the therapy they need, live a better quality of life, we're achieving our mission.
Right. And what are you hearing from your patients that compels your work?
Well, our community is very vocal, and they're very clear about what their priorities are right now. It's access to care, first and foremost. Access is a critical need. Affordability, so that medications and other therapies are affordable and people can actually sustain that therapy. And the third is finding a way that they can use those therapies to improve the quality of their life. They are looking for innovation, continued innovation. So for us, it's about access, affordability, and innovation.
And then what is one urgent thing that needs to be done to help these patients?
I think right now, in today's current environment, the number one priority is access to care and access to therapies in a time frame that actually matters to those families. And at NBDF, we're working really hard to find ways to improve access to care, including something we call CCSC, which is the Comprehensive Care Sustainability Collaborative, which brings together payers, doctors, our stakeholders in industry, and patients to really address these problems head on. In addition, we're working on federal legislative advocacy in Washington, and then also at the state level, we're building public policy initiatives that can help people right where they live, because every state has a little bit different need. And so we're really fortunate to have chapters around the country that are working really hard within their communities to make a difference.
Right. And what gives you hope about the future of scientific innovation?
You know, hope is everything in bleeding disorders. And to me, the biggest hope that I have is watching how therapies have come forward in a way that they've never come forward before. It's not just the number of new therapies that are coming forward, Jeff. It's really the way that they're coming forward. It's really individualized medicine. It's much more targeted. You know, there are new therapies that are allowing people to not have to have infusions quite as often. They're able to live their life more freely. And whether it's gene therapy or extended release products or any other new innovation that's coming forward, that's the hope for our community. And I just want to say thank you to Sanofi, because with your leadership and the service that you and your team are providing, our community is benefiting from that. And so we're really proud to be a partner.
Thank you.